Hello everyone, my name is Dr. Michael Schechter. I'm a dentist practicing in Toronto, Ontario, and I take a more holistic or comprehensive approach to dentistry. I feel very fortunate and excited to be a part of the greater Well Earth Collaborative community, and I've been asked to do a series on dental toxicity and how it plays a role in the lives, the health of patients that are living with multiple chemical sensitivities or electrical sensitivities. I want to thank the Wellness Intelligence Collective for giving us this amazing platform to share with our patients and to share with the greater community. I want to give a little shout out to Lisa Borden. Thank you so much for helping us out and supporting our initiatives. I'm hoping that this video blog, this communication will become more interactive. I welcome patients to come live onto this setting the first Monday of every month. And if you have questions, you can message me through the Twic platform in advance. You can message me while we're on. You can come on live and you can ask me questions, and I'm happy to share and collaborate as we learn together how to better live in the world around us, how to better reduce toxicity, reduce invasiveness, and hopefully live healthier lives for ourselves and for the planet. So I'm a dentist in Toronto, like I said. I graduated from the University of Toronto in 2006, and I've been practicing in Toronto ever since. From early on, I started getting patients that came to me with very complex chronic illnesses. And I started to appreciate and understand the connection between what's going on in their mouths and what's going on in their overall systems. Started to ask questions. Are there materials that are making people sick? Are there infections that are making people sick? And the questions and answers aren't necessarily clear, but there are some trends that have come out of it. And it's helped me, organize my practice around these type of ideas, both for patients that are more sensitive and both, for the general public. I've taken additional training in homeopathy and nutrition, and I'm excited to be a part of this WEC community where we can really help to work with patients and learn from patients about how to better treat together as a group. And so it's not just me working isolated as a dentist, it's not just a nutritionist working isolated or a medical doctor working isolated, but it's all of us working together as a team. And that is, I think, a real advancement in how we're looking at medicine. And I think that as WEC is continuing to grow and moving forward, I really see it as an opportunity to re-envision how medicine can be for all of us. This is my first time, I think, doing something live online, so it's kind of an exciting landmark for me. And again, I'm looking forward to continuing to grow together with the community as we continue to do this. The most important thing that I want to emphasize is anything that I talk about today are maybe some general concepts in dentistry, maybe some of my own opinions or thoughts. However, if you yourself is having a specific dental issue, please go to your dentist. That's the best person to speak to about an issue that you're having. And it's a way that you can correctly correlate your opinions, your symptoms, your findings with what's actually going on in your mouth, okay? So, when we're looking at patients that have multiple chemical sensitivities and are living with, EHS, the question is, can we treat this subset of patients the same as we treat everybody else? And, I think not. And so, for example, if somebody comes in to see me and they have these type of sensitivities, maybe they're reacting to electrical signals, radiation around them, whether it's cell phones or hydro wires, maybe they're reacting to chemicals, whether it's something in the pillow, something in the mattress, something in disinfectants or cleaners. I think that we have to step back and recognize that these patients, and maybe you yourself who's listening, is more sensitive in general. And that's where I think the nuance is when it comes to dentistry. And so if a patient comes in to see me and they're unwell and they're asking, is there a dental correlation between my overall health, my overall wellness, and what's going on in my mouth, I try to look at different things. And so the first thing that I look at is there any metal in the mouth? And so, metal can come in different forms. It can come as a denture, which is a removable plate. It can come as a substructure underneath the crown or a bridge. So some crowns and bridges, even though they have a porcelain outside, will still have a metal substructure that's encased around the tooth. Some patients will still come with the older amalgam mercury-based fillings, and some patients will come in with the titanium metal implants. According to the Royal College of Dentistry in Ontario, according to Health Canada, these modalities are considered safe for the average population. What we're talking about today is how are these impacting that subset of the population that is arguably more sensitive. And so there's value in taking a look to see if these different types of metals are in the mouth. And then I try to work together with the practitioner team that's supporting the patient. So is there an allergist? Is there a medical doctor? Is there a naturopath? And we discuss these different materials, and is there a potential that there's some sort of interaction? So if there's a patient that is allergic to zinc, if there's a patient that has sensitivity to radio frequencies, is a galvanic effect in the mouth contributing to their illness? I've had patients where when we replace their amalgam filling safely, or when we remove the metal in the mouth, their overall health picture changes, improves. Not always, but sometimes. And so it's something that we have to look at on an individual basis. I think, looking at the research, working with patients, I think it's the electrical current that's generated off of these metals that is what is actually causing the issue. And so when we can remove that electrical current, remove that galvanic effect, it can help to eliminate the issue. When it's something like a removable bridge, denture, it's easy. We just take it out. How does the patient react? When it's something more involved like an implant, it really takes a lot of planning and conversation to make sure that it's the right thing for the patient. What we don't want to do is be overly invasive and potentially have the patient incur, a high financial cost as well as an invasive procedure for nothing. And so things should be done quite diligently. But I've had in my own practice these patients that have reacted so well. I've had patients where they've had amalgam fillings replaced and all of a sudden their chronic fatigue is lifted. I had a patient that he was in the hospital with a really bad staph infection in the face for months, and when she had her titanium implants removed, not by me, her entire health picture improved. All of her symptoms went away. And so again, it's something to look at on an individual basis. Another thought is there infection in the mouth? I just had a patient who came in to see me a few weeks ago. She has a few root canals in her mouth. She wanted everything checked. One of the root canals has a clear chronic infection around the base of the root canal. After discussion and further testing, we decided that it was best to remove the tooth. After we removed the tooth, all sorts of different symptoms improved. She found immediately when the tooth was removed, she described it almost like a whoosh or a rush of energy that went through her body. And the root canal was on the left side. All of these left-sided symptoms started to dissipate. So her weakness in her left arm started to go away. Her ability to use her legs improved. The muscle pain and discomfort in her left leg improved. And all of these symptoms started to improve. I'm not sitting here and saying that all root canals should be removed. I'm not sitting here and saying that every root canal is infected. What I'm saying is that, one, if someone is suffering from chronic illness, there's value in taking a look at the dental health and making sure that we're clear of any infection or potential any potential contributions to that chronic illness. And I think that there's value in just trying to individualize care and making sure that we're doing what's best for the individual patient. With this particular patient, there was a clear infection that was visible on just a regular x-ray that was taken in the dental office. Whenever I see any patient, I think that it's important to just step back and do an overall evaluation, right? We want to make sure that the dental health and the gum health, the periodontal health is solid. We always do a full exam, check everything, and make sure that we're working towards a healthy picture. I think what's reasonable to understand is that when you're looking at gum health or periodontal health, the inflammation or infection that exists under the gums can potentially have a relationship with the overall wellness in our system. And there's been a strong correlation where inflammatory disease is a trigger for inflammatory disease. So diabetes will put pressure on our gums. Unhealthy gums will put pressure on sugar levels. Unhealthy gums will put pressure on our cardiovascular system, etc. And so on top of these, quote unquote, latent infections or potential toxins that are in the body, we also want to make sure that overall dental health is there. So I think that's a reasonable introduction to what we're trying to look at and what we're trying to do from a dental perspective. I recognize that some of these ideas can be controversial, and again, I want to emphasize that it's critical for me to really individualize the care and also work together with the primary health team. And so we're not doing anything in a vacuum, we're not doing anything isolated, but working together. Another really interesting area in dentistry that can assist patients with chronic illness is the idea of airway. And so it's a broad concept that we can get deeper into as we do more of these video blogs and Q&As. But the concept is, or I guess the extreme would be something like sleep apnea, where the airway is constricted. And so when we're sleeping, it kind of falls back and the tongue will fall back into the airway and it will cause a blockage. And that type of blockage can cause us to startle and waken, gasping for breath at night, snore at night, but sometimes it's even on a lower level where it's not something that we can necessarily notice ourselves. But there are different signs that a dentist can pick up on. Maybe the jaw is a little further in, or the upper jaw, the maxilla hasn't been developed, it's a little flat. Perhaps there's a tongue tie. Perhaps just the palate has a very high vault. And when you combine that with perhaps some unclear nasal passages or a larger tongue, then perhaps there's too much obstruction in the throat. And it's easily tested these days with a sleep ring, where you can take this ring home and pair it to your phone and do a sleep study at home to assess the quality of your sleep. And if we can see that there is an obstructive issue or an issue with sleep, then we can go through a program where we're actually creating expansion, and it's done with like almost like an orthodontic appliance, where you can get this expansion of the upper lower jaw and create more space for the tongue. And it's amazing how sleep can be improved. And once you're improving airway and you're improving sleep and you're getting more nasal breathing, then all of a sudden some of these pressures on our overall system start to dissipate. And it's amazing to see the chronic issues that can go away. We've seen with children things like bedwetting, ADHD, behavioral issues, and even greater chronic issues like cardiovascular issues and blood sugar issues can be alleviated once we get that airway regulated. And so it's another really neat thing to look at when we're taking a look at anyone at any age of development, whether they're a child or an adult. And I encourage all of you to have that conversation with your dentist and almost do like a sleep screening, where you can answer different questions about your sleep and about your restfulness during the day, and make sure that it isn't one of those hidden or unknown pressures on your system that can be impacting your overall health. I should just kind of jump back for 1 second and talk about, when we were talking about those titanium implants, and talk about the advances that we now have in ceramic dentistry. And so I've been placing zirconia or ceramic implants for better part of 7 years now, and the technological advancements that have come are fantastic. And so when we first started, we were using these one-piece block ceramic implants. And so it had to have this little piece that was sticking up into the mouth, and then the crown would get cemented on top. And we've come so far now where the design is very similar to the titanium implants, where the implant goes in and it's at the gum level, and then we can screw in a full zirconia crown with a zirconia screw. And so the entire process is completely metal free.
And it's really been a lovely option for patients that have electrical sensitivities. It's a lovely option for patients that are looking to avoid metal. It's a great option if you even have like a thinner gum type where you don't want to necessarily show that gray metal showing through the gums. And so it's something to consider if you are someone that's missing a tooth and is looking to replace that tooth with a option that I would consider to have fewer potential interactions. There's a reduced electrical or galvanic effect, and potentially a more aesthetic option depending on the type of gums that one has. So I think I'm going to sign off for today. I appreciate everyone's time. If you do have a question or follow-up about this, don't hesitate to message me through the Twic platform. And I look forward to seeing more of you as this blog progresses. Everyone have a lovely day. Be well.